Hi everyone, welcome to week 2. Notice Leah probably gave you 2 packets of PowerPoints or one thick one. The first one says medical terminology. There's only about 6 or 7 sheets there, so I'm not going to go over that. You can flip through those, and there is a worksheet that Leah will be sending home with you to work on, and you can use your book to find that, and also next week bring it with you because Leah will be giving you the answer key. All right, but I wanted to make sure that I covered the chemical, fire, and electrical safety portion of the lab. Today you're going to be doing a little bit of a scavenger hunt, reviewing some of the safety features of the laboratory that you're going to be working in for the next year and a half or so. So I want to give you a little bit of a preface as to what it is that you're going to be looking for. Okay, so regulation of workplace safety is controlled by a place called OSHA. OSHA came into place to make sure that employers were providing their employees with all the safety measures possible to make sure that they wouldn't hurt themselves. We are mandated by the same place to make sure that we are providing you with gloves, lab coats, eyewear, fire extinguishers, everything that it is that you need. We also follow the Wisconsin State Safety Codes. Every employer that you work for will be a little bit different, and you will have to follow their safety training program. When I got a job at St. Vincent Hospital, right out of college, I did their safety program. When I was done there, I went to Bellin. Bellin had me do their safety program. Both of them have a comprehensive safety manual, which is a little bit different, and it depends on the site and what the differences are between the sites. It is the employer's responsibility to provide the proper training, make sure that training is documented, to enforce those safety guidelines, and to provide the safety equipment necessary. But on the opposite side, it is your responsibility to make sure that you comply with that safety plan, that your fellow coworkers are protected as well, and that you wear the personal protective equipment that is given to you by us. What is personal protective equipment? Well, it includes eye, face, and skin protection. In the laboratory, we use goggles or face shields and masks, mostly goggles. By the way, if you do wear glasses, I'm picturing, who wears glasses? Do any of you wear glasses? Maybe you don't. If you don't, you have to wear safety, or you have to wear the goggles we provide you. If you wear eyeglasses, that is acceptable. There's usually respirators and a fume hood, some type of chemical resistant gloves, depending on what you're using, and a laboratory coat. It's very important when putting gloves on that they don't rip when you put them on, but also when you take them off. You want to avoid exposure when removing contaminated gloves. If you guys have time today, you can practice putting some on, and Lena can show you, I keep calling her Lena, sorry Leah. She can show you how to properly take them off. One of the parts of your lab today includes looking for physical hazards. You're going to look at things like microscopes, centrifuges, spectrophotometers, and such to look for anything that could potentially harm you while you're using it. Look at the electrical cords. Is there anything frayed? Any cord sticking out? Look at, is there any fire hazards? The equipment instruments, or anything sticking out that could poke you, any glassware that could cause some issues. And also, if you see the physical hazard icon as shown in this picture, it could mean there is a physical hazard. You're also going to go look at the fire extinguisher out in the hallway. You also need to know the exit route and know the location of the fire extinguisher along with some other information on it. Leah's going to walk you through all of that. We do have a chemical hygiene plan. Leah's going to show you where the chemicals are located. We have a MSDS sheet on hand for every chemical that we have. In the MSDS sheet, well, we're going to talk about that in a minute. The MSDS sheets tell you how to handle those chemicals. When there is a chemical hazard, this is the icon you may see. Here's the MSDS sheets. There should be a book here. I'm going to skip to this one. Every label every chemical label has some type of NFPA diamond on it. They don't all look exactly like this, but they do include this same type of information. So you can pull one out and take a look when you do this later. But what you need to know, and this will be on a lot of quizzes in this course and along with quizzes in the clinical chemistry course, you have to be familiar with this. Blue always refers to a health hazard. Every single color has numbers, 0 being the least dangerous and 4 being the most dangerous. So if it was a health hazard with a level 0, it would be like water. If it was a health hazard number 4, it would be too dangerous to enter vapor or liquid, so it would be way too hazardous to you. Flammable, 4 is extremely flammable, 0 would be will not burn, kind of like water. Reactive, 4 would be it might detonate, so be very careful. 0 would be normally stable, something probably like water. There's also a yellow part on the diamond. This symbol means do not add water, because it could probably detonate, you know, because things that might detonate you don't add water to, or some other things that you may see. It usually has a comment on it. But when you go and look in the MSDS sheets for each of the chemicals, you will have an NFPA diamond in there. Here's an example of some other chemical warning labels that you might see. There's corrosive materials, toxic chemicals, flammable things, cancer hazards, radioactivity, acid, caustic. Caustic means it might burn through something, or flammable. We do have some safety equipment. We do not have a shower in our laboratory because we don't have things toxic enough to do so, but we do have an eye wash. Leah will show you how to use the eye wash today. This is an example of a fume hood. We do not have one here at Rasmussen because we don't need one with what we use. If you end up doing your clinicals in a large hospital, you will notice that they do have these. Laboratory apparel is very important. We do have paper gowns similar to this. They're a little bit more long wearing than this, but make sure that you wear the appropriate clothing for the job. You can see this lady has a splash shield but doesn't have any respiratory protection. So it would just depend on the job that she was doing. With nursing, it's a little bit more important with this. In the lab, we're exposed to the same things pretty much day in, day out. So we pretty much just wear eyewear, gloves, and a lab coat. Some of the general safety rules, and you'll see these on the back of the lab door. Report accidents right away. If you poke yourself with a needle or something, make sure that you notify us. Know where the MSDS sheets are. Don't eat in the work area. In our case, that is the dirty side. Leah can point to where that is right now. Wear protective clothing and closed-toed shoes. Even if you're wearing tennis shoes that have mesh on the top of them, I tell you, it does not feel good to pour warm urine on your feet on accident and have it go through the mesh on the top of your tennis shoes. You want something a little more with like a leather upper on them. If you have long hair, pin it back. You don't want your hair falling in some urine either. And don't wear loose jewelry. It can pick up bacteria or get caught in a chemistry analyzer. Use chemical resistant gloves when needed. Clean your work area frequently. There's nothing worse than going to a work area and seeing sticky urine and serum all over everything. Wash your hands frequently, especially upon leaving the laboratory. Wear protective face wear when needed and wipe up spills appropriately. Make sure you know what the spills are before you clean them up. Don't assume it's just water. You may need to use the fume hood mask or respirator depending on what it is you're dealing with. If you're in a large hospital lab and you're using TB specimens or working with them, you want to make sure you use that fume hood. Always follow the manufacturer's directions with that. Report damaged wires. With broken glass, don't just bend over and pick it up. Okay? Make sure you use a pan and a broom. And follow facility policy regarding visitors. A lot of times they don't want visitors within the laboratory. And that concludes our section on chemistry, chemical hazards. Leah is going to lead you on a little bit of a scavenger hunt around the lab and explain your lab to you, which includes looking at the fire extinguishers, doing the exit route, looking at the MSDS book, and things like that. That information will then need to be sent to Becky Tao via your lab section.